Thank you for joining. Power to Practice 2-Minute Tuesdays presents how to administer an IV. Today, we will review how to administer an IV, as well as documenting and additional features to improve your workflow. Once you are in the patient's chart, navigate to the Ordering section and select the IVs, Injection and Vaccine tab. The drop-down menu shown here, below Details, should default to IV Therapy. Begin typing the name of the IV and select from the auto-populated options. For this example, we will select the Myers cocktail. Enter in the ordering provider. If you need to edit this field, simply delete the name and begin entering in the new provider's name, then select from the auto-populated options. Select the start date of the order. The option to post the date out is available as well. You also have the ability to use the frequency drop-down menu if any order needs to be placed on a routine schedule. One time is the standard default. You can select recurring fixed if the order needs to be placed on a routine for X amount of days, weeks, or months until a certain date, or select recurring relative if the order needs to be placed for every other day, week, or month. Let's select one time for this example. By selecting the checkbox for standing order, then click Order. This will create a document that will stay under the pending orders, and it can be used for multiple IV visits, no matter how many times it's ordered. It will remain here until it has been deleted. We will select this for our example. Select the IV order and then click on Administer to open the order details. Enter the pre-infusion details shown here in this example. Add any notes if applicable and the date of service. It's important to note that pre-charting is available. Simply put in your note in the Notes field to indicate that you are pre-charting. Add in the information in the needed areas, then click Save. This will place the order under the History tab, making it available to select when you are ready to administer the IV. Make any edits to the pre-infusion details. Enter in the lot number, expiration date, and pharmacy for each ingredient. Click on Add to add any additional ingredients, or use the trash bin icon to remove any lines from the order. Begin typing in the name of the person who mixed and who administered the IV and select from the auto-populated options. Enter in the remaining inspection details shown here. Under the Upon Removal section, complete the checkboxes and add any additional notes. Then click Sign. The summary of the appointment will generate in PDF format and will be available in the Documents section of the patient's chart. This document will be marked private automatically. Deselect the private checkbox from the document in the Documents section to make the IV summary visible from the patient portal. Thank you for joining the Power to Practice 2-Minute Tuesdays presentation on how to administer an IV. Look out for more 2-Minute Tuesdays coming your way.